We're putting in place an additional $1.1 billion for a national medical and research strategy to address COVID-19. This plan has 3 pillars: research on vaccines and other treatments, supports for clinical trials, and expanding national testing and modeling.
Welcome back to the program. That was Prime Minister Justin Trudeau from earlier today outlining the government's new $1.1 billion COVID-19 research strategy. The money will go towards vaccine research and development, clinical trials, and this is key, really getting some national testing. We only had to do 20,000 tests a day in a country of over 36 million people. Is this enough to boost Canada's testing capacity to a place where we can safely start to reopen the economy? And what good is research with lawmakers discredit Canada's top medical experts? Let's get some answers right now with Innovation Minister Navdeep Bains. Minister, I hope you and the family are okay. I appreciate you joining us. Can you give us a sense of, if the vaccine is developed in Canada, what's the protocol from there? Will Canada prioritize access to a vaccine to Canadians before shipping it around the world?
Well, the goal is to collaborate with other jurisdictions and to make sure we leverage our world-class scientists and researchers in terms of helping with the development of this vaccine. We want to build production capacity in Canada as well so we can provide that vaccine to Canadians. That is the objective, is to make sure we prioritize Canadians and also help other jurisdictions.
Testing is critical. We got to ramp up testing in a big way. There's money for that. Can you give us a sense of how fast, do we know of a test that works? And how fast can we ramp up to hundreds of thousands of tests a day?
There's different components to this. One of the initiatives around testing that we promoted today is regards to the immunity task force. These are blood tests that will allow us to understand the immunity levels within Canadians in a much broader population. And in this case, we're talking about millions of Canadians. We're also looking at Genome Canada and how we can do DNA sequencing to better understand the DNA sequencing of individuals. And with regards to particular testing and test kits that are being discussed right now, one of the companies we invested in was Spartan Bioscience, and this is a portable test kit that will enable frontline clinics or at the airports when we want to reopen the economy to be able to have rapid test responses.
Okay, that's interesting. The government, you just spoke about this, and you have this task force that will be headed by a group of doctors, including the Chief Public Health Officer, Dr. Teresa Tam, which is important. But you've got Derek Sloan. He's an elected Conservative MP. He's running to be the leader of that party. He put out a video saying, does she work for Canada or does she work for China? What do you make of that? What's your comment about questioning her credibility and her loyalty to Canada?
Look, I've had the opportunity to work very closely with Dr. Tam. Every day she's up there communicating in a very transparent way public health-related policies to protect Canadians. She's working on behalf of Canadians to make sure that we flatten the curve, that we save lives, and I have complete confidence in her ability to execute on that mandate and to protect Canadians.
Premier Moe from Saskatchewan is about to join us. He's got a staggered approach to reopening the Saskatchewan economy. Will the federal government have a federal plan that all provinces will have to follow, or will provinces basically be able to develop their own reopening plan?
I think one of the things you've seen, Evan, with respects to this current health crisis is our ability to collaborate and work very closely with the provinces and territories, including Saskatchewan. We want to work in a collaborative fashion that doesn't undermine the work we've done to protect Canadians, their health and their well-being. And at the same time, we want to make sure that we reopen the economy in a manner that avoids another spike, another challenge to our healthcare system, and to really protect and save Canadian lives. And so we want to be thoughtful, we want to be deliberate, but we also want to work in a collaborative fashion that is based on the advice and the guidance given by the public health agencies.
Minister, can I just go back to the national testing capacity? And I know you just mentioned you want millions. How is that going to happen? Can you give us a sense of how fast that can go on? And are people going to be obliged to get tested? Will they have to be retested? How does that work?
So this immunity task force is a consortium of experts led by Dr. David Naylor. You mentioned Dr. Tam as well, and the chief science advisor, Dr. Niemer, all of them are going to be working with the provinces and territories to make sure that we test as many Canadians as possible. Up to 2 million Canadians is the target over the next few months. And that is the goal, to ramp this up over the next few months and few years. So we understand which Canadians are immune, how this virus behaves, and that will inform our ability and the public health officials to make better decisions.
All right, I got to leave it there. Minister Bains, I always appreciate seeing you, sir. Thank you so much, and take good care.